It's the dawn of a new decade. You can be you again with mini dental implants. Do you suffer with loose dentures? Are you embarrassed to smile because you're missing teeth? Mini dental implants will change your life.
I've had problems with my teeth.
I had this big hole in my mouth.
I knew it was time to do something permanent.
It's just unbelievable what it's done to my life.
I feel like me again.
It'll be the best, smartest move you ever made.
Kind of gave me my life back.
The mini implants are the only way to go.
Just real happy I did it.
I would recommend it to anyone.
Do it over in a heartbeat.
It's been great.
It's incredible. It is. It's absolutely incredible.
Hello everybody, I'm John DeSciullo and welcome to Innovations in Health. We're talking about the mini dental implant procedure. It will change your life. And I'm welcoming Dr. Kymberlie Clarke from A Better Smile Dental Center. You're going to learn about the mini dental implant procedure. It's 5 times less. It's less invasive, less painful. It's less healing time, less visits to the dentist, less cost, and it's an affordable solution for you. Dr. Clarke, welcome to the show.
Thank you, John. Thank you for having me.
We're going to get to know you in just a little bit, but before we do, let's take a look at the difference between a mini and a conventional implant, showing what we call the mandible example.
Sure. We have the replica of a jaw here, and as you can see, we have 2 holes, one larger and one very small, much like a pinhole. So the larger hole is what we use when we're placing conventional implants, and like I said, it's much larger than the smaller hole that we use for mini implants. It's less invasive. So when we're making this hole, there's less bleeding, it's very quick, and it's painless.
And it takes a lot longer with the conventional implants.
A lot longer, John.
And with the minis, you can see just by the size of the hole that the incision is so much shorter, and you don't need as much bone to make the titanium post get into place.
Right, you don't need as much bone at all, and that bone forms around the mini dental implant very quickly. It's called osseointegration, and it's just a very quick, lovely procedure that we can offer our patients now.
All right, so now let's take a look at a denture example, and I know dentures are a big part of your practice. Now imagine, folks, that lower denture. It's swimming around on the bottom of your gums. I know a lot of you who are watching this know what I'm talking about. Well, watch this, because Dr. Clarke is going to show you how your lower denture is now going to be stabilized and maybe not even fall out. In fact, it won't fall out of your mouth.
Yes, John. So this is the #1 complaint in our practice. And so what we've done to rectify that is we've placed these 4 mini dental implants in the lower jaw. As you can see, those titanium posts here. And that's a really quick, really simple procedure to do. And then we attach the attachments on the underside of the denture, and therefore we're able to just snap the denture in place. Our patients can now chew anything. That steak that we love, our surf and turf here, they can chew that lobster and that shrimp, and the denture won't fall out. It's amazing.
Well, and you had mentioned earlier that sometimes people don't even wear their lower denture because they just don't want it to fall out. They just are embarrassed by it.
Right. A lot of times our patients take their dentures out to eat, which defeats the purpose of having a denture. They usually just wear it in pictures or to church or some kind of social event, but they typically come in the office with a denture in their purse or in a napkin.
Now, one important point to make, that adhesive that's used to keep it in place is gone.
No more adhesive, no more goop. The only reason the goop is needed is to stabilize the denture. Well, now you have your mini implants here to stabilize the denture. No more goop. You never have to use it again.
Sounds terrific. Now, odds are if you have a lower denture, you probably have an upper. And I know the foods that we love here in Jacksonville, the taste is going to come back because the palate is going to be exposed. And show us why with the upper denture example.
The second biggest complaint in our practice is that upper denture with that palate. So now what we're able to do is place 6 mini implants on top and put the attachments on the underside of the denture just like we did the lower denture, and we're able to snap it in place. Now the best thing about the upper is that all of that palate is removed. No more acrylic, no more plastic. You can taste your delicious foods and you won't gag Like I said, we have a lot of gaggers in our practice because we do a lot of these, and this is the second biggest complaint after the loose lower denture.
And I know that with the upper denture, that plastic is to keep it up there with that suction, but it also impacts your speech too. You don't speak as well. So now the fact is that you can enjoy the foods that you've enjoyed all your life, and if you have a denture, there's no reason not to get the mini dental implant, no matter what your age.
That's right. We serve patients from 20s on up. We have a lot of younger patients, and we have a solution for a patient of any age.
And I know that you do a lot of work with dentures. I know you work with the patient to take the extraction out for their teeth, and you create the denture for them. What's the typical appointment like when you talk with a patient about their denture or their need for a denture?
So we bring the patient in for a consult, and we're a little unique where we have our own denture lab, so we can create a denture in a day or two. So the patient comes in that morning, we make their impressions after we take all of their x-rays, send those impressions to our dental lab, let them start constructing the denture. They come back that afternoon, I remove all of their teeth, and then we place the implants or the denture or whatever prosthesis that we're going to be placing, and they leave with a smile. No one ever leaves our office without a smile.
They don't leave without a smile, they don't leave without teeth, and you're changing their lives.
Absolutely.
With every procedure. Now, the mini dental implant procedure is not just for dentures. There's another level, and I know that this is going to be exciting to see because the plastic that goes with the denture in its traditional form is gone with what we call the fixed on 6.
Yeah, so this is one of my favorites because now we can take our denture patients and give them a more natural looking smile. And we use a material called zirconia, which is very durable, very strong, and very beautiful. So it mimics your natural teeth. And you don't have all of the acrylic that you would on the denture. We place the mini implants on the top, typically about 6, and then we put the attachments on the underside of the fix on 6 so that it snaps in place. However, the patient never has to take this out. So it's permanent for the patient. Now, when the patient comes in for their dental appointments, we can remove it and clean around the areas. So we love this option because it's a permanent solution for the patient and it's beautiful.
It's bad going through life having to cover your face because you're embarrassed of your teeth. But I didn't want dentures. I had the fixed on 6 done. It was easy. It literally changed my life. I can eat anything now. I can smile, I laugh. I don't have to cover my face anymore. It was awesome.
You can be you again with mini dental implants. Call a Better Smile Dental Center today for your free consultation and give us the opportunity to change your life.
Now, if that isn't enough, if God gave us our baby teeth and our adult teeth, Dr. Kymberlie Clarke from a Better Smile Dental Center is going to give us our third set of teeth with what we call the roundhouse. This is a premium permanent solution.
Yes, we call this the Big Daddy in our office. This is our premium prosthesis, and it's beautiful just like the Fix on 6 because it's made of those zirconia crowns. As you can see, very natural looking, very strong, very durable, but this is cemented in. And because it's cemented in, we add a few more implants for the stability, but we cement it in place and no one ever removes this. So this is a wonderful product as well. Like I said, this is our premium prosthesis.
It looks beautiful, and it's an in-office procedure, by the way, and Dr. Kymberlie Clarke and her team will help you. Kathy's over there, you know, she's the mini implant dental coordinator. She's gonna make sure everything is good. Now, I know that some people have teeth in the back of their mouth, Dr. Clarke.
Yes.
And they neglect them. And it's the old story, out of sight, out of mind, I'm not going to worry about it.
Right.
But those back teeth, as we all know, are the workhorse teeth. They're the ones that chew the food. And the face is really contoured because if those teeth rot or there's a problem, your face sinks in and you don't look very good. So let's take a look at that, because the back teeth are very important, and look at the solution the mini dental implant will afford you.
Absolutely. So if you're missing one tooth or several teeth, we can do the same thing here and place those mini dental implants in these beautiful zirconia crowns that are cemented permanently, and they match the existing teeth. So it is very important for people to replace those back teeth, and we have people come into our office all of the time and they're missing those teeth and they say, well, you know, it's in the back, we don't have to worry about it. And that's simply not the case, because you start having drifting and shifting of your other teeth. And then if you keep losing your teeth, then you start chewing on your front teeth and you start damaging your front teeth because you're gonna chew with whatever teeth you have.
Yeah, those front teeth are not made to do all that
Yeah,
chewing. The
they're-
back teeth are made to do that. And you're going to do this on your dad, I heard.
Yes, yes. So we've already started the implants, a 5-unit bridge from the back to the front. And he was very excited to have that placed where he can now chew all of his foods. He loves steak. And so now we're going to bring him back in and place the bridge. And he's very excited about that.
So if it's good enough for Dr. Clarke's dad, it's good enough for you.
Absolutely.
Now, you know, the single tooth option, you get a sports injury or you lose a tooth or there's some issue with your tooth, but a single tooth can be fixed with a custom-made mini dental implant.
Yes, and John, as I told you before, I have 4 boys, and thankfully this has not happened, but I see it a lot in my practice where people lose that front tooth and they're stuck wearing a flipper that comes in and out, and who wants to wear that? It's not very comfortable. You can't really eat well with it. And so we can simply place the mini implant in the front there and make a custom-made zirconia crown that matches the existing teeth. And it's a quick, easy, beautiful procedure that we offer.
Yeah, and it's custom made, as you mentioned. This is a made in America product. It's formed just for your mouth, colored just for your mouth, so it looks exactly like it should. And with those side teeth, I know that you worked on a patient just a little while ago, and you were able to bring that individual's smile back,
Yes.
and that individual's confidence back to eat well.
Yes. So one of her complaints was that every time she ate potato chips, she would cut her inside of her mouth because she didn't have those side back teeth. So we were able to replace those, and she gave us the comment that this is the first time she has really smiled in a long time because they were in her visual field where you could see those missing teeth. And so she was very, very happy when she left our office.
Well, Dr. Kymberlie Clarke is bringing your smile back at a Better Smile Dental Center. They're at 2804 St. John's Bluff Road South, Suite 200, off the 295 and Beach Boulevard. We all know where that is, in Jacksonville. Here's the phone number to call. It's been on the screen, but you want to make that call to make the appointment at 904-875-5601. And if you want to find out more online, it's JacksonvilleFL-Mini-Dental-Implants.com. So you make that call and you make that appointment because the mini dental implant will change your life. Now, we promised that we'd get to know Dr. Clarke. And I'm so happy that you're here. You're a Jacksonville native.
I am.
Yeah,
I
so
am.
Jacksonville has been in your life forever.
Yes, born and raised.
Yeah.
Yeah.
Tell us about your family.
So my husband Nate and I have 4 boys from ages 16 to 26. So in about a year and 8 months, we'll be empty nesters. So we're very excited about that. We'll
Busy-
just have our dog, Nico.
Busy family.
Busy family.
Dr. Clarke, where did you go to school?
I went to dental school at University of Florida in Gainesville, Florida. Go Gators. But I do serve a lot of Georgia patients, and I love my Georgia patients, so please don't hold it against me.
There you go. All right, so you've had great schooling and a great loyalty to your school.
Yes.
And I know that in your family itself, there have been others that were involved in oral surgery and dentistry that served as an inspiration, going back to your, I think, great-grandfather.
Yes. So I guess you can say it's in my blood. My great-grandfather was an oral surgeon, and I had 3 uncles that were dentists. But I wasn't sure that I wanted to be a dentist, so I taught for chemistry for a couple of years. And then I decided to go to dental school, but I think what really solidified dentistry for me as a path was when I took my first mission trip at the end of my freshman year in dental school, and I knew that I had to do that for the rest of my life.
Talk to us about the mission trip, because this is a very special piece that's close to your heart.
Yeah, it's very special. It's been a blessing for me for over 15 years, probably longer. I've gone all over the world to help the underserved, and there's no better feeling than that.
Yeah. And when you go across, I guess, Mexico, and what other countries that you've
Yes,
gone to?
I've been to Africa, Asia, South America, Central America, the Amazon, a lot of different places all over.
And I know in some of the pictures that you showed us, you're working with children and adults as well.
Yes.
And they must be so excited just to get their smile back or alleviate pain.
I think the biggest thing for those patients is to get them out of pain. And they are so appreciative, but I believe I get the bigger blessing just by being able to serve them.
It's beautiful that you do that, and hats off to you, Dr. Clarke.
Thank
for
you.
doing
It's
that.
truly a blessing for me.
We should mention, too, that you're a member of the American Dental Association,
Yes.
Jacksonville Dental Society, Northeast District Dental Society, National Dental Society, and of course, we're in the Sunshine State, so you're in the Sunshine State Dental Society. But we should also say that you've been in practice for 21 years and having your own practice for about a dozen years.
Yes, yes. So I lived in Miami for a little while, but then I came to back home and I opened my own practice.
Yeah.
So it's been great.
Now here in Jacksonville, you know, we talked about all the great foods that we love and, you know, all the great lifestyle of living so close to the ocean. But I know that you like to travel up north, and every once in a while you got to head up to Buffalo, and there you meet Dr. Todd Shatkin, who is an innovator in the mini dental implant procedure. What do you learn from him that you bring back down here to Florida?
Oh, so I've learned so much. I'm going into my second year of training under Dr. Shatkin, and he's just a wealth of knowledge. He's placed over 20,000 of these implants and has been doing it, 25 years?
Yeah, a long time.
And I've worked with other implant systems, but have never had the training like I've had with Dr. Shatkin, and it's just marvelous, and it has benefited my patients so much.
And your patients are going to a Better Smile Dental Center, and it's an in-office procedure.
Yes.
Yeah,
it's an
so
in-office procedure.
imagine that. You go in and you're not going to leave without teeth. And I know that with that, you also offer some general dentistry and cosmetic dentistry. So if somebody needs to go to the dentist, they can call and make an appointment.
Absolutely. We do all the general dentistry there. And now we're placing a lot of mini implants.
Yeah.
And having great results.
And you know, it's important to go to the dentist. I just had a health checkup, and the doctor said, "Have you been to the dentist recently?" And I thought, oh, this is interesting. Where are you going with this? And the doc said, Dr. Nataro, she said, you know why? Because you see so many health issues that sometimes start
in the mouth.
In the patient's mouth.
Yes, absolutely.
So it's important for you. And you know, with that, some people will say, well, I haven't been to the dentist for a while. And they should not go backwards in time and relive any trauma that they may have had, even as a child, should they?
No, they shouldn't. And the type of practice I have where we do a lot of dentures, primarily it's because patients have been traumatized as kids, and so they haven't been to the dentist in 15, 20 years. But I think we restore their confidence in dentistry after they leave our office.
And I know you work with the patient because obviously there's some cost involved, and we're all used to paying for our homes with a mortgage and our cars on time and paying for different things in different ways. So you make this an affordable option for the patient.
Yes. So the mini dental implant is more affordable than the conventional implant in itself. However, we do partner with several finance companies, and my implant coordinator, Kathy, works with the patient and the finance companies to develop a plan that is affordable for each patient.
That's terrific. So you and Kathy are going to work with that patient and make it affordable just for you. It's very important because this is an investment in your life. If you're looking for a new relationship, if you are going out for a job, you just want to look better, or you're of an age where you want to enjoy the rest of your life with the great foods that we love here in Florida and Georgia.
Absolutely.
Yeah. And you have what's called the cone beam. It sounds like something out of a science fiction movie, but that cone beam gives you a three-dimensional image of the patient, and that comes with a free consultation.
Yes, it does. And I love that free consultation because I get to know the patient, get to know you, and you get to know me and my staff. And you also get to know your mouth because we can look at this 3D image together, and you can see everywhere you have bone, the places where I'm going to plan to place the implant. We can look together where your vital structures are, where we need to stay away from. So it's an educational piece for the dentist and the patient.
Yeah, and that helps you create that custom-made tooth to fit in, like
Absolutely.
we talked about. And now some people may say, well, I want to be sedated. Do you offer sedation?
We offer nitrous oxide. However, most of our patients never need it because it's such a quick procedure, and it's not invasive. And at the end of the procedure, most of the patients only need ibuprofen.
Yeah. We talked a lot, too, about the age of your patient, and you help patients who've gone through some trauma in their life. Maybe they've had bad hygiene or they've made some life decisions that have meant that their teeth are not going to be their best, and you work with those patients individually.
Yes, and I think that has been one of the greatest blessings of my life, to be able to offer a new smile to these patients, because they've been through so much, and a lot of them are 20, 25. I think our youngest was 16 or 17. And so consequently, because of some of the past trauma and past things that they've gone through, we've had to remove all of their teeth and create new smiles. But they're at the point in their lives where they want to go out, they want to have a second lease on life, get a job, and their confidence is just overflowing by the time they leave us.
Yeah. And I know that's very important to you to work with the patients. You're changing their lives, and some of them have touched you personally.
Yes, one in particular, her name is Linda, and she was a previous patient of mine, but I hadn't seen her in a while. And she was going through a lot of difficult times in her life, had a lot of misfortune, and she came into my office crying because she was wearing just a basic upper denture. And I think that was just the last straw. And she was very frustrated. And she could not keep the denture in her mouth because she would gag every time. And so we decided to place 6 implants on the top and give her an upper overdenture. And after we did that, the lady that was crying in my office and very sad, I have never seen that again. Every time she comes to see us now, she's such a beautiful woman inside and out, and now it's reflected in her face and her smile, and she's a totally different person.
And it's one thing, Dr. Clarke, for you to tell us about the story, but I think it's important now we hear from the patients themselves, including Linda, about how their lives have been changed.
My loose dentures were gagging me.
Chips used to cut my gums up because the teeth were missing right there.
I couldn't eat almost anything.
It was almost as an impossibility to eat.
I hadn't taken a bite of a cheeseburger in probably 10 years.
So I went to Dr. Clarke in total tears. Her compassionate answer, mini implants.
I can eat everything. It's unbelievable.
But now I can eat all the crunchy stuff.
They snap right into place. They stay put.
It was done, over, done. Let's go home and eat.
They feel great. They're so comfortable, I can't even tell the difference.
I had dinner 45 minutes later.
I'm eating all my favorite food now.
And my teeth aren't falling out of my mouth.
She didn't solve all my life problems, but she gave me the ability to smile through them.
There you heard it, all those great patients, their lives have been changed by Dr. Kymberlie Clarke. A Better Smile Dental Center, 2804 St. John's Bluff Road South, Suite 200. You know, it's off 295 and Beach Boulevard. We all know where that is, in Jacksonville. The number to call, 904-875-5601, and online, JacksonvilleFLMiniDentalImplants.com. For everybody in Jacksonville, the beaches, if you're down at the Naval Air Station, Jacksonville, the North Estates, to the Heights in the South, the Florida-Georgia line, and anywhere in between, Dr. Kymberlie Clarke and her team are there for you. We talked about the mini dental implant. It's less invasive, less painful, less healing time, less visits to the dentist, less cost. It's an affordable solution. And Doc, I think it's important you mentioned with that issue where it is less pain, in fact, no pain, and over-the-counter medication is all you really need.
We give some prescriptions to our patients, but they inevitably come back and say, oh, I just took the ibuprofen.
And a water flosser would be an optimal way to care for your mini dental implant.
Yes, so we offer the water flosser in our office, and this is the best way to clean around those implants because you still have the same bacteria in your mouth that you did with natural teeth. So you want to protect those implants with the water flossing and your general brushing and flossing and seeing your dentist twice a year.
Yep, very important to come and see the dentist. Now, if you've been with us for the whole half hour, you're learning about the mini dental implant procedure, and you saw some of the models. Now, if you joined us halfway through and you missed that, you want to pay close attention because this really hits home as to why the mini dental implant procedure is going to change your life. Now, let's start again with the difference between a conventional and a mini with this mandible, Dr. Clarke.
Okay, so there you see 2 holes. The larger hole we use for the conventional implant, and the smaller hole is for the mini implant. So you can see it's less invasive.
Takes less time, and certainly, very important, it's less cost. And the whole difference right there in the size would be a big seller for me. Now, if you have a lower denture that's swimming around on the bottom of your gums and you're very concerned it's going to fall out, you're not able to eat, watch this.
Yes, so we place the 4 mini implants at the bottom, and we have the attachments on the underside of the denture, and it just snaps in. No more goop, The goop is gone.
Goop is gone. We like to say that, Dr. Clarke, and
Yes.
then you swallow all that goop. It tastes terrible.
Right, it tastes terrible. So none of that with this anymore. It stays in the mouth. You can eat anything.
Eat anything. And speaking of eating, we love our foods here in Jacksonville and Georgia. We love our seafood. We love to bite into a juicy steak. The upper denture mini dental implant exposes the palate so the taste buds come back.
Yeah, so we place those 6 mini implants on top, those attachments underside the denture, snaps in, no palate. You can taste that delicious lobster or shrimp and also not gag.
And have that confidence back. Flip that up so we see it as an upper. Look how beautiful that is as an upper denture. And that suction that is needed with the full plastic is not needed with the mini dental implant because that titanium post is going to keep it in place.
Right, so no more plastic.
Yeah. Now, if we have another example that's going to make you motivated to want to make the call, this is going to be it. This is called the Fixed on 6.
Yeah, so like I said, this is one of my favorites, and this is a permanent solution for the patient. And we have those same 6 mini implants and attachments on the underside, but this is made with zirconia. So it's a very natural material, looks like your natural teeth, and it doesn't have all of the plastic that the dentures have. And it's very beautiful, very strong.
And you can have the upper or the lower or both. Now, if God gave us our baby teeth and adult teeth, Dr. Kymberlie Clarke is going to give us the Big Daddy,
the Big
the
Daddy.
roundhouse.
This is our Big Daddy. And so it's the same thing as the Fixed on 6 as far as those beautiful zirconia crowns. But we place a few more implants on the top so that we can cement this in. This one never comes out. So we love this one, and it's beautiful. And for patients that want a permanent solution, this would be it.
Yeah, and only you can make that treatment in the doctor's office, in the dentist's office. Now, if you have teeth in the back of your mouth that you've neglected, you don't want to do that anymore. Dr. Clarke has an answer. She's even going to do this with her dad, so pay attention.
Right. So we have those mini implants placed in those back areas, whether it's 1 or whether it's 4. We place those mini implants in, and those zirconia crowns or bridge that match your existing teeth, and they're strong and they're cemented in, never to come out.
And you know, most people have that sort of metal that clasps onto the tooth. It looks horrible.
Yes, yes.
No need to do that.
No need to do that. No need to do that. So you don't need a partial denture with the metal, which I hate, but you know, it's an option. But this is a much better option, these mini dental implants, if you're a candidate for it.
And the single tooth option as well. You mentioned, you know, your boys and
Yes.
the people that might have sporting accidents.
Right.
Any issue with the single tooth missing. No more flipper, by the way, when you have this, right?
Right, no more flipper. So all we do is place that single implant wherever you're having that missing tooth, and a custom-made zirconia crown, strong and natural, cemented in place, and it looks just like your remaining teeth.
So when you go to see Dr. Kymberlie Clarke at A Better Smile Dental Center, 2804 St. John's Bluff Road South, you will never leave without a smile, and you'll never leave without teeth, right?
Right.
Yeah,
Exactly
that's
right.
terrific. And I know, Dr. Clarke, it's been inspiring for you to be a dentist, not only to help people here in the Jacksonville area, but also people across the globe.
So that is a huge blessing for me in my life, and it's truly, if you will, my calling. I will do that until God tells me I can't.
Yeah. Well, we are happy that you are doing it for all of us. You are an innovator in health with the mini dental implant procedure and all that you do, and we thank you for joining us on the show.
Thank you so much, John.
Thank you, and thank you for watching.